Go through and start talking about neuroradiology stuff. So, what does neuroradiology really mean? And we're going to talk about things that include the entire skull, everything in the head, and everything in the axial skeleton. So, basically, the spinal column and the spinal cord. That is what we're going to cover in the topic of neuroradiology. The other thing that I'll tell you is that, and I'm sure Dr. Warner told you the same thing, when you're shooting radiographs. Oh, here's another question for you. What's the difference between a radiograph and an X-ray? Anybody know that? Well, a radiograph is the real word for the picture you look at on a computer monitor, or in the old days, you would hold the piece of film in your hand. That's the picture. That's the radiograph. The X-rays are invisible and they pass through the patient. Okay. So what I would, like for you guys to start doing is start talking like a doctor. And everybody calls the radiographs X-rays. I do too. But in reality, you should start trying to talk like a doctor and get in the habit of, when you talk to clients and your technicians, and say, you should probably say, let's go shoot some radiographs and let's look at the radiographs, or show me the radiographs on the monitor, instead of let's go get the X-rays. Okay, because you're not really getting the X-rays. It's semantics, but in reality, that's true. So a film that we're going to look at through all of this is really a radiograph and not an X-ray. Got it? Okay. So the first thing to keep in mind is symmetry is the best friend of a neuroradiologist. And by that, you got to keep in mind that film quality and positioning is super important. It's super important with anything you have to do with radiology. If you get, it's a garbage in, garbage out kind of thing. If you get crappy films that are overexposed in black, or they're underexposed and too wide, or they're crooked, or they're not positioned well, or there's movement artifact from the dog panting and stuff like that, the pictures are going to look crappy, the radiographs look crappy, and it's hard to interpret them. Okay. And so film quality and good positioning cannot be overstressed when we're talking about radiographs. It's the same thing in human medicine. Okay. But symmetry, what do I mean by symmetry, is the neuroradiologist's best friend. I mean that as long as you have a good quality film that's positioned nicely, a lot of times the right side of the animal should look just like the left side in almost every case. Okay. And so sometimes, like if you're looking at an MRI of a dog brain, you don't even need to know the anatomic names of the structures inside the brain. If he's positioned nicely, all you have to keep in mind is the right side should look just like the left side. If something looks different on one side or the other, it's probably abnormal. Okay. Same thing for the spinal column. Okay. The vertebrae and stuff like that. Same thing in the skull. You shoot a nice straight VD view of the skull. As long as it's positioned straightly, the right side should look just like the left side in any dog. So positioning is critical. Okay, the other thing to keep in mind because positioning is critical, especially when you're talking about neuroradiology, is for the most part, anytime you're shooting films for a neurologic type case, general anesthesia is going to be a necessity. There's very few dogs you're going to be able to lie on their back, stretch their neck out, and get good quality films without the aid of general anesthesia. So gas anesthesia is typically the best. They're going to be completely under anesthesia. There's a difference between general anesthesia and sedation. Okay. So sedation most of the time will not work because they're not completely out. Okay. So general anesthesia, either with gas anesthesia or propofol that you can keep redosing as needed, is going to be required in pretty much every case with neuroradiology stuff. Sometimes if you're shooting thoracic films or abdominal films, it may not be needed. But neuro stuff, because positioning is so critical in neuro stuff, for the most part, general anesthesia is going to be needed. Okay, so that's kind of my intro into neuroradiology. And now we're going to start talking about disease conditions. And again, I would hope that when I lecture this stuff, you have already heard of these conditions, and for the most part, you have not, because you haven't had your neuro class. Okay, so the first one we're going to talk about is hydrocephalus. So hydrocephalus you probably heard of, and literally if you take the word apart, hydro means water and cephalus means the head. So that means water on the head. Okay. So in general, that's what it is. So hydrocephalus is increased water, or CSF, which is basically clear like water, inside the ventricles of the brain. Okay. And if you remember, we'll review the anatomy here in just a second. But inside the brain, there's ventricles, and they have different names. And the ventricles normally should be filled with CSF, or cerebral spinal fluid. And around the brain, there's also a very small amount of cerebral spinal fluid in the meninges around the brain that kind of bathe the brain and keep everything from rubbing against the skull. So it kind of acts like a bath around the brain, keeps it nice and wet and things like that. And it kind of also acts like a shock absorber around the brain. Okay, and then we remember CSF also goes down the middle of the spinal cord throughout the entire length of the spinal cord in what's called the central canal, and that is contiguous with the ventricles in the brain. And there's also a small amount of cerebral spinal fluid that bathes and is surrounding the entire length of the spinal cord to where it ends. Okay, so hydrocephalus is an overproduction or obstruction of outflow of CSF. That's what causes it. The CSF, if you remember, is made inside the brain, and specifically inside the lining of the ventricles. There's this finger-like, villi that lives, kind of this velvet-like stuff that lives inside the ventricles of the brain, called the choroid plexus, if you remember that. And the choroid plexus is the stuff inside the ventricles that actually makes CSF and produces it, and then it lets it go out free in the ventricles of the brain, and then everything from there communicates with the ventricles of the brain. Okay, so hydrocephalus can be caused by an overproduction of CSF by the choroid plexus, or the choroid plexus can be making a normal amount of CSF, but it can't get out of the ventricles and out of the brain due to something that's obstructing it. Okay. For the most part, hydrocephalus can either be congenital or acquired, and probably 99% of the time it's congenital. Okay. Typically, the dogs that will present with hydrocephalus will be the young toy breed dogs, and most commonly it's the dogs with big rounded dome heads. So like Boston Terriers and Pekingese and Bulldogs and things like that. These dogs typically are going to present to you, and a lot of times they're completely normal, or they might have, they might be a little mentally dull. Sometimes if it gets really bad, they can actually become uncoordinated and show neurologic signs, or even have seizures if the hydrocephalus is really severe. But a lot of times they're just a normal dog. I mean, how smart does a Chihuahua really need to be, right? Or a Bulldog. So a lot of times you don't even notice anything. The thing to keep in mind, we're talking for the most part in this class about radiology. Talking about MRI and CT is a little bit beyond what we need to be doing when you're in the first part of radiology. And so when you're talking about radiographs, trying to make a diagnosis of hydrocephalus, radiographs are for the most part very insensitive. In other words, they're piss poor at trying to diagnose hydrocephalus. Okay. The real way to diagnose hydrocephalus is going to be with CT or MRI, or sometimes ultrasound. On the other hand, there's a few hints that we can get from plain film radiographs that might suggest a dog has hydrocephalus, which we'll talk about. So what are Röntgen signs? Well, this is a tribute to Wilhelm Röntgen. So whenever we talk about Röntgen signs, and I'm sure Dr. Warner talked about this with you, we talk about what do we see on x-rays that would suggest a certain disease condition, in this case, hydrocephalus. So we're going to talk about these as we look at some pictures here coming up, all these Röntgen signs that would suggest hydrocephalus. First off, let's review the anatomy. And again, here is a kind of a dorsal ventral view of just the ventricular system in the brain. Here's a lateral view. So here's the big part of the brain, the cerebrum. Here's the little part of the brain that's caudal to it, called the cerebellum. Okay, and inside the middle of the cerebrum and the cerebellum is the ventricular system. So here's a lateral view of it. Here's a dorsal ventral view of it. So the names of the ventricular system that's inside the head or inside the brain, we have two lateral ventricles. That's this thing here, around here, and on the other side, there's one here and one here. They're right on either side. So there's a right lateral ventricle and a left lateral ventricle. Okay. And typically those lateral ventricles should be very small, kind of slit-like, and they contain cerebral spinal fluid. Okay. Then you have this middle part right in here of that ventricle, and that's called the third ventricle. And then you have this other little outpouching, which is kind of right down in this area right in here. That's the fourth ventricle. Okay. And then you have communications that go out into the central canal that passes all the way down through the spinal cord, all the way down to about the level of L6. Okay. So that's the ventricular system. And inside the lining of these ventricles, mostly in the third and fourth ventricle, is the choroid plexus, which actually makes the cerebral spinal fluid. Okay. So that's the anatomy of the ventricular system in the brain. There's other names that if you really want to get into it, that's the communications between the lateral ventricles, and the third ventricle is the interventricular foramen. And then this one here is the mesencephalic aqueduct that connects the third and the fourth ventricles. That you can get into also if you want to, but you basically need to know the names of the ventricles. Now, why they named it this way back in the day, I have no idea. The lateral ventricles make sense because there's one on each side and they're lateral. They lateralize to the right and left sides. Why they started with this one being the third one and this one being the fourth one, and my question is what happened to the first and second ones? I have no idea. Okay, so it's just one of those things. So lateral ventricles, third ventricle, fourth ventricle is the parts that's inside the brain. Okay, so what are the Röntgen signs that we may see on radiographs that would suggest hydrocephalus? Well, the appearance of the Röntgen signs are dependent on how fast the CSF's made, the size of the ventricles, and the age of the animal. So here's what kind of we see. If you look at this is a sagittal view cut in half of a dog's skull. Okay, so here is the calvarium. So that's where the brain sits. And if you remember from your anatomy, so that's where the brain, the cerebrum part of the brain sits there. And if you remember looking at that inside of the skull in there, it has these little ridges and convolutions inside. So it's kind of like a trough here and a ridge here and a trough here and a ridge here. So it has these ridges or convolutions, and normally that's where the gyri and the sulci of the brain sit right up against it. Okay, so that's just an anatomic view of a skull cut in sagittal dimension. Here's an X-ray or a radiograph, really, of a dog that's normal. Okay, and if you look, you can actually see these ridges and convolutions inside that part of the skull. Okay, looks like there's a little indentation here, and between it there's a little opacity. That's one of the ridges inside the skull. So it's typically, normally in dogs, you'll see these little ridges and convolutions that make it look somewhat heterogeneous inside the skull itself. Okay, some dogs that have hydrocephalus, you don't, this is the same radiograph you just saw. Some dogs, you lose that opacity. Okay, and now the entire skull is all smoothed out. You don't see those convolutions and ridges radiographically inside the skull. That is a suggestion of this dog might have hydrocephalus. And the way I always thought about that is the amount of CSF, the ventricles get too big, it's too much fluid inside these ventricles, and they put pressure on the brain, which in turn in these young dogs put pressure on the inside of the calvarium, and it will not allow these ridges to form. Okay, so it kind of smooths them all out. So one suggestion you can get with plain films for hydrocephalus is you do not see these convolutions inside the brain. A lot of the dogs will also have this hole in their head. Okay, so if you look up in here, here's the calvarium, and there's no bone there. Okay, it's just a hole in their head. Now, let me tell you this, that is called the dorsal fontanelle. Most all dogs that when they're first born, they will have a small hole in their head. That's normal. It's an open dorsal fontanelle. People have the same thing. Babies will have the same thing. You can actually palpate on the top of a puppy or a kitten or a baby, and you can feel there's a hole in their head. Normally, that hole should fill in with bone pretty quickly after birth, okay, to where it ends up looking like that. Typically, you can see a little vestige of it right in here. There's a little loosened, that used to be probably the dorsal fontanelle, but normally in this dog, it filled in with bone, okay? There are some dogs, though, that dorsal fontanelle will never fill in with bone. And the most common ones will be these dome-headed, round-headed dogs, bulldogs, Pekingese, Chihuahuas, things like that, okay? Now, a lot of the dogs with hydrocephalus will have an open fontanelle, but just because you see an open fontanelle doesn't mean they have hydrocephalus. Some dogs will have an open fontanelle that persists for life, okay? And it usually doesn't mean a damn thing, but it doesn't necessarily mean they have hydrocephalus, okay? The other thing that I look for is if we go back here to this picture here, okay, we can see, again, this is the place where the cerebrum sits, okay, the big part of the brain. And then back here, kind of cut off the edge of the film, is where the cerebellum sits, okay? And there's a shelf of bone that sits right in here that on the radiograph, you can see it sit right in here. That shelf of bone is called the osseous tentorium or the tentorium cerebelli, which again, if you take that word apart, it means a tent, tentorium, over the cerebellum. Okay, so it is a bony tent sitting on top of the cerebellum. Okay, typically you can see that on radiographs. There it is. It's this little protuberance of bone that you can see right in there in the base of the skull. Okay, dogs, here's that same x-ray here, okay, but do you see that area on this dog that has smoothed out areas that has hydrocephalus? No, you see just a little hint of it, okay? So one other thing that I typically look for is lack of appearance of a normal appearing tentorium cerebelli. This is normal. Here, this dog just has a little hint of it. And again, I take that, and it's simplistic, but the way I remember it is there's so much pressure in the brain, it doesn't let that part of the bone, that tentorium cerebelli, form. And so it becomes very small. Okay. The real way to diagnose hydrocephalus is with CT or MRI or sometimes ultrasound. So here is a MRI of a dog, and you can look in here. Here's his brain. This is in cross section. So the right side here should look just like the left side over here. Okay. And if you look, this little area right in here is part of the lateral ventricle. It kind of swoops down like this, but you can see it and it looks symmetrical. Again, as long as you have the dogs positioned nicely, you compare the right side to the left side and it should look for the most part exactly the same. Okay. This is a dog that has hydrocephalus. So now we have the ventricles, the lateral ventricles on each side are severely dilated with fluid, this black kind of gray fluid stuff. Okay, so this is a dog with hydrocephalus. This little area right in here is part of the third ventricle, which is kind of coming right out at you from the screen. Okay, over here, this is the literal third ventricle in a normal dog. So even that third ventricle is dilated. And you can imagine that as these lateral ventricles become more and more dilated, it puts pressure on the brain around it. So it will put pressure on the cerebral cortex right in here. And that cerebral cortex becomes really, really thin. Sometimes it will be just a very thin rim of brain around this big, huge dilated ventricle. Okay. And you can imagine that if you put a lot of pressure on your brain, that's what leads to the clinical signs of being mentally dull or kind of retarded in a dog, and can lead to seizure activity and being uncoordinated, especially if the third ventricle and the fourth ventricle become dilated and puts pressure on the cerebellum. Okay. So, and again, if it's a Chihuahua, it's probably, you're not going to notice anything because all Chihuahuas act like they're kind of mentally dull, at least in my opinion. Okay. This is an ultrasound. If you have a dog that looks like this, that has a big open fontanelle with no bone there, that's your window to the brain with an ultrasound probe. You can stick an ultrasound probe right there, set it right on that part of the brain or that part of the open fontanelle, and you can peer into the brain with ultrasound. If they have bone there, ultrasound won't penetrate through bone and that won't work. But if you have an open fontanelle, you can palpate, take advantage of it if you have ultrasound, and you can ultrasound the brain and the ventricles to see if you see a big dilated ventricle. So here is big dilated ventricle on one side. Here it is kind of coming across the other side. This is the mid portion of the brain. And again, normally it should be just a little bitty slit of a little bit of CSF in the lateral ventricles. Okay, enough about hydrocephalus. So if I was to ask you on a quiz coming up, are radiographs a really good way and a sensitive way to diagnose hydrocephalus? And you would say, hell no. Okay, it's a piss poor way. The real way is with CT or ultrasound or with MRI. However, sometimes you get lucky, right? Not often, but sometimes you get lucky, and sometimes you'll get a hint of hydrocephalus based on plain films. The other thing that I could ask you is, just because you see an open fontanelle of a dog, does that mean he has hydrocephalus? The answer to that would be no. Some dogs can have open fontanelles for all of their entire life, especially if they're a big dome-headed dog, but that doesn't necessarily mean they have hydrocephalus. On the other hand, the great majority of dogs that do have hydrocephalus will also have an open fontanelle. All right. Moving on, the next condition we are going to talk about is one called occipital dysplasia. Okay, so again, let's take the name apart. Where is the occipital bone? You remember that from anatomy? It's part of one of the skull bones. And the occipital bone is the one that's way back here in the base of the brain, base of the head. Okay. And there's a big hole in the occipital bone called the foramen magnum, which is the hole where the spinal cord emerges from the brain stem. Okay. So the occipital bone is all the bone that surrounds the foramen magnum. Okay, so that's one part of that word. Dysplasia, what does dysplasia mean? Dysplasia means it didn't form right. That's what dysplasia means. So this is the occipital bone that didn't form right. That's what this condition is. It's a congenital, meaning the dog is born with it, malformation of the foramen magnum and the occipital bone. There's 3 grades of severity we'll talk about. Most of the time, again, this comes in young toy breed dome-headed dogs. Little poodles and chihuahuas and Pekingese and things like that. Okay. A lot of times the dogs that come in with occipital dysplasia, they will be a little bit uncoordinated. They may have a little bit of, pain if you palpate back on the base of their skull, but a lot of times they'll also be clinically normal. You won't notice anything at all wrong with these dogs. Occipital dysplasia is a lot like hydrocephalus in that radiographs can be a piss poor way to try to diagnose this condition. The real way is going to be, again, CT or MRI. But again, let's see some examples of what you can get a hint. So here is, if I was looking at the base of the skull of a dog, okay, this is the occipital bone, all of this bone that surrounds this big hole called the foramen magnum. And in a normal dog, this is the way it should be. So the spinal cord will be coming out at you end on from this area of the foramen magnum. And the bone dorsal to this region, the right side of the occipital bone and the left side of the occipital bone should be fused and nice, tightly tied together. Okay. Occipital dysplasia happens when the dorsal margin of the occipital bone does not fuse right to left, and it leaves an extension of the foramen magnum that can lead dorsally up here. So it kind of then looks like, instead of a round foramen magnum, it has this dorsal open extension, kind of a keyhole looking thing. Okay. And so now this right side of the occipital bone, dorsal to the foramen magnum, has not fused with the left side. And that leads to this congenital anomaly called occipital dysplasia. Okay. So now we don't have bone in there. We know that just rostral or cranial to that area lives what part of the brain? That's where the cerebellum lives. And if we don't have bone there to hold the cerebellum in place, for sometimes that cerebellum can then herniate out caudally through this abnormal extension of the foramen magnum, which can lead to neurologic signs. Okay. So here, this is crappy film, but here are crappy pictures, but here is how you would try to position a dog to see this radiographically. You kind of put their nose right here and you shoot the x-ray right, kind of picking off where the frontal sinus is on the top of the brain. And if you get lucky, again, right side should look just like the left side. You have to make sure their nose is straight. It can't be off to one side or to the left or to the right. Okay. So again, if you get lucky and you get a nice shot of it, this is the foramen magnum here. And this dog has occipital dysplasia. We can see the continuation dorsally of the foramen magnum all up through this region. And this part should be fused together, the right and left side, but it's not. Okay. And so if you see this dorsal extension of this radiolucent foramen magnum, that is occipital dysplasia. And again, people will grade these because everybody has to grade everything. You have to grade heart murmurs, grade neurologic signs, grade everything. And so this, a grade 1 or mild occipital dysplasia would be where the dorsal extension right here is less wide than the foramen magnum itself. If the dorsal extension is the same width as the foramen magnum, that would be a grade 2 or moderate. If the dorsal extension of the foramen magnum is wider than the foramen magnum itself, that would be a severe or grade 3. Okay. So here's another example. Here's another dog. Here's the occipital, the foramen magnum here, and here's its large dorsal extent. So you can see from here to here, it's probably wider than the foramen itself. So that's probably a grade 3, occipital dysplasia. And again, a lot of these dogs, even with grade 3, they may not show any clinical signs. Over time, they may develop clinical signs though. Okay, so that's occipital dysplasia. There is a variant of occipital dysplasia that happens in people and in animals called Chiari syndrome. Okay, one of the differences in veterinary medicine versus human medicine, if you were going to be a physician, is human medicine, especially surgeons, have huge egos for the most part, right? And so back in the day, whenever Dr. Whoever discovered something and wrote about it for the first time, instead of calling it anatomically what it is, they decided it's better to name it after themselves. I mean, how egotistical is that, right? But people do that all the time in human medicine. Sometimes you'll see that in veterinary medicine, but not very often. In veterinary medicine, we tend to call things what they are, okay, anatomically. So Chiari syndrome was named after, guess who? Dr. Chiari. Okay. So what is Chiari syndrome? We see it in people, they see it in people a lot, but they also see it relatively commonly in King Charles Cavalier Spaniels. It's a weird thing that happens in King Charles Cavalier Spaniels. Okay. And Chiari syndrome is again a variant of occipital dysplasia. It is where a part of the cerebellum, the part of the brain that sits just cranial to the occipital bone, squeezes through and tends to herniate out of the brain, out of the calvarium and into the spinal canal where the cerebellum is and the foramen magnum is. Dogs that have Chiari syndrome, in most part, this is usually King Charles Cavaliers, they come in and they have weird clinical signs. They have neck pain. If you move their head around, they're painful. They'll start to scream. If you squeeze at the base of their skull on either side with your fingers, a lot of times they'll just completely go paralyzed. They go down and they're very painful in that area. The other thing that a lot of these dogs that you'll see when they come in is they will constantly be scratching, and the owners think they're scratching their ears, which basically they're scratching behind the ears, back in the neck, because there's something back there that irritates them. And I think they kind of scratch at it to try to ease the pain or try to make it go away. And so a lot of these dogs, the owners will complain it's a King Charles Cavalier, and they are constantly scratching their ears. You look in their ears, and their ears look fine. Okay, that should raise a question mark for you. So what do you see with Chiari syndrome? Most of these dogs, radiographically, you'll never see it. The only way to diagnose Chiari syndrome in a dog is with MRI. And so this is a normal MRI of a dog brain and sagittal section. So here is the cerebrum, the big part of the brain. Okay, this is the cerebellum. Okay, that's the balance and coordination part of the brain. This is the brain stem. Coming in here, the pons and the brain stem, and then this is the spinal cord going out the foramen magnum that sits right in here. Okay, in dogs that have Chiari syndrome, a part of the cerebellum, it looks like a tongue. It's actually herniating through the foramen magnum or this occipital dysplasia and compresses it. So you get crowding or caudal crowding of the cerebellum, and it forces a part of the cerebellum to herniate through the foramen magnum, and that's what's causing the clinical signs. Okay. You will never ever see that with radiographs. You will never find it with ultrasound because there's too much bone around it, and ultrasound doesn't penetrate through bone. Okay. But you will see it with MRI. Even CT is not good to see this. So MRI is the way to go if you have a King Charles Cavalier that comes in and you suspect they may have Chiari syndrome. All right. The next one we're going to talk about is a kind of a cool disease syndrome called craniomandibular osteopathy. Okay, and again, if we take that word apart, cranial is easy, mandibular is easy, it has to do with the mandible, and osteopathy. Osteo means bone, and pathy means something's wrong with it. Okay, some kind of pathology. So it's basically a nondescript name. So it's something wrong with the bone in the mandible, is basically what that means. Okay. So craniomandibular osteopathy, nobody knows what causes it. Some people back in the day thought it was viral. Bottom line, anytime there's controversy on what causes something, that really means nobody knows, and they have to debate it. Okay, so even to this day, nobody knows what causes craniomandibular osteopathy. This is a really weird condition. It also happens in people, but it also happens in basically only one breed of dog, and it happens in Westies. So West Highland White Terriers get craniomandibular osteopathy. I've seen it in other breeds, but it's pretty rare. It's almost always a Westie condition. Okay. Typically, these dogs are going to come in, they're going to be less than a year of age, so very young dogs. Okay. And they come in, and the owners will complain that the dog can't open his mouth. Okay. Then, when they try to open their mouth, or if they're forced to open their mouth by grabbing them and pulling it open, it's really painful. Okay. And because they can't open their mouth, that means they can't eat or eat very well. And because they can't eat, they start losing weight. Okay. So that's typically the owner's going to come bring them in because the dog won't eat. They can't eat. They can't open their mouth. And now they're losing a bunch of weight. They don't know what the hell's going on. And it's a Westie. Okay. This one is very good to find with radiographs. So radiographs are very sensitive to find dogs and make this diagnosis with craniomandibular osteopathy. You only need two views, get a VD view and a lateral view. And what do you see with this? You see typically you're going to see, here's a lateral view, here's a VD view. You see bony production along the ventral aspect of both right and left sides of the mandible. And sometimes it can extend caudally all the way around the middle ear, which is called the tympanic bulla on both sides. And sometimes it can actually go up and involve the temporomandibular joint as well. And especially if it involves the temporomandibular joint, then the dogs can't open their mouth. Okay, so on a real radiograph, this is what you see. Here's a lateral view. We see all of this bony production along the ventral aspect, kind of very irregular in shape, and it become really severe, really, really obvious. But it's symmetrical. The right side looks just like the left side. There's absolutely no bony lysis. Nothing's destroying or eating the bone away. It's just bony production along the ventral aspect of the right and left side of the mandible that's symmetrical. And then all this bony production can extend up to the region of the middle ear, the tympanic bulla, and sometimes that's the temporomandibular joint. It will also involve the temporomandibular joint. Okay, here's kind of a close-up. All this irregular bony production along the ventral aspect of the mandible. Okay, and that's just a VD view showing on right and left sides. All this more opaque here than it should be, more opaque in the region of the tympanic bulla. It's symmetrical when you compare the right and left side. So the cool thing about craniomandibular osteopathy in Westies is if you give it time, it'll completely go away on its own. There's not, I mean, you can put the dog on NSAIDs, you can put him on Rimadyl, you can put him on antibiotics, you can put him on anything you want, but basically you're probably not doing anything. This will relieve itself and go away on its own, whether you treat it or not. Okay. And typically it'll give it another 3 or 4 months and it will completely go away. And the cool thing about it is if you re-radiograph the mandible, even though it have lots of bony production early on and it's very obvious, give it 2 or 3, 4 months and re-radiograph the mandible, it'll look completely normal. So it's a self-limiting disease. The key thing with these dogs is you have to control the pain. So sometimes I'll put them on pain medication. Sometimes they'll, give them NSAIDs, which I think can ease some of the pain and the inflammation. But the biggest thing is you have to nutritionally support these dogs because they can't open their mouth. You have to get their food and put it in some type of a gruel, put it in a blender, and force feed it through a syringe into their mouths and do that several times every day to try to nutritionally support the dogs until it goes away. Okay, so that's craniomandibular osteopathy, kind of a cool disease that's self-limiting, and it goes away on its own. Okay, nutritionally support these dogs. Okay, the next one is otitis media, and we're going to take our little break, our bathroom break, and y'all can come back here. Let's come back here at, what is it, 11 o'clock your time, and we'll continue with otitis media. Is that cool?
Yes.
All right, see you then.